Welcome back, everyone. We have our final session today and the final session for the pre-licensing part of the conference. And it will be with Adam Van Spankeren, and he is presenting on special enrollment periods. I'm going to hand it right over to Adam.
Good morning, everybody. I hope you've enjoyed your pre-licensing journey this week, and I have little doubt that you're excited that this is the last session, and hopefully you're not too overcome with new knowledge to still learn a couple things. Although I will hopefully leave you with just a few takeaways that are like, okay, if I remember nothing else, I can stay with this. But again, I'm Adam Van Spankeren. I am the Navigator Program Manager for Covering Wisconsin. You saw me on Wednesday with our somewhat cursed session on walking through the marketplace application. Some of that was just trying to get fancy and show a live demo, and I did take away some lessons learned. Although, Elizabeth, I think you said that people were interested in another demo of the application at some point in the future,
Yes.
and I will be happy to do that for folks. I mean, I love this stuff, and I hope that shows. And I will be happy to go over it in as much detail and maybe get into some really complex situations. You can't prepare for everything. Most of your education as an assister, really, I mean, we do the conference, you do the federal training, you do the exam, and a lot of it still comes from what you experience in the field because you could come up with every situation you could conceive of, every consumer coverage issue, and learn them all, and then somebody will still throw you a curveball on day one. That's the fun part. But you do have an extensive network at covering Wisconsin and amongst the other navigators and CACs throughout the state who've been doing this for years, who will be able to help answer your questions. So don't feel like you have to know everything because even if you did, you will still be surprised. I will say, I just want to say thank you to Elizabeth. She has been the one holding down this pre-licensing, and I actually will give her a live round of applause. I know you guys can't, she can't hear you, but please, if you want to express in the Q&A just your appreciation for Elizabeth. I think she's done a great job. I have been in that role before. It is it's a little bit of a gauntlet holding it down and moderating through so many sessions of so much information, and I just want to express my appreciation for her as a colleague for doing all that for covering Wisconsin. So thank you, Elizabeth. So today, we'll talk about special enrollment periods. And if you see me looking over to the side, that's me looking at the chat, the Q&A, without doing the live demo that we were trying on Wednesday. I can actually see everything now, which is fantastic. And it just makes me look a little bit like a streamer where I'm like, okay, now I gotta do this. But for the most part, I will be going through these slides and I hopefully will catch questions. We can save questions for the end, but as you guys saw from the other day, I like to stop and answer things as you think of them, just because then we're not getting, nobody's trying to hold on to a kernel of a question or something confusing so much that they're not able to take in the new information that's being presented on the slides. We want to go ahead and make sure that we've got plenty of time today, and we're almost done. And we will go ahead and make sure that you guys have the forum that you need to get some of these complexities ironed out. So we'll go over the basics of special enrollment periods, and we're talking special enrollment periods specific to the marketplace now. There are special enrollment periods for employer-sponsored coverage, things like that, and I certainly could field questions about those. But we're talking about, I think you guys learned health insurance 101 and some marketplace stuff, and I walked you through the application. But now that you'll see some of the more practical applications of how this actually works for most of the year. So you've got open enrollment starting November 1st, and that's kind of the easiest time, the easiest applications you'll do because there you don't need to worry about whether or not somebody is going to be able to get coverage. But that leaves the rest of the year for folks who need to, they're losing coverage, just household situations changing, they're moving, all the things we'll look at today, and we'll be able to go over those and find out the different conditions and how to actually access these special enrollment periods. So we'll do the most common ones, the bread and butter steps, as I like to refer to them. We'll do some uncommon ones that, even uncommon as they are, you will see them. They do come up, and you will want to know how to handle them. and then some other considerations for assisters. You will see also on our slide there, that is one of our fact sheets. I'm sure if you haven't already been inundated with covering Wisconsin content, you will know by the end of the conference where our fact sheets live and how to use them. Our special enrollment fact sheet is a really good one. Again, we put everything in plain language so consumers can easily understand these tough concepts. All right. So basics of special enrollment periods. So what is a special enrollment period? That's number one. It's probably come up several times throughout pre-licensing already. It's probably going to come up on the exam for those of you who need to take that. Special enrollment period refers to when somebody has a life event that will enable them to get insurance from the marketplace, right? Almost always, the next bullet point, the minimum essential coverage. Uh, you will find as a refrain throughout this presentation that I'm doing that a lot of it comes down to loss of coverage, right? What is the most common special enrollment period we're going to see? It's people losing coverage and needing other coverage. So that's what you're going to see most throughout the year when you're helping people. It's, hey, I'm over income for Badger Care. I need to find out what other options I have. Hey, I'm losing my job or changing jobs. My new job doesn't have health insurance. My coverage ends on X date, and that will trigger a special enrollment period. So there's events that's going to be the most common is the loss of coverage. And minimum essential coverage refers to, and I bet you guys got the full detailed definition earlier, but minimum essential coverage refers to a plan, a health plan, or a program like Badger Care that meets the minimum standards set by the Affordable Care Act, right? The easiest way to think of minimum essential coverage is, does this meet all of the conditions that I think of when I think of health insurance? So like I really like layman definitions, thinking of things the way that consumers think of them. So if something is minimum essential coverage, it's going to cover prescriptions, it's going to cover emergency room visits, it's going to cover your primary care doctor, your labs, your tests, things like that. If something has exclusions or doesn't feel right, looks weird, has, oh, we don't cover ER visits, things like that, then you start questioning it and you can look into whether something's minimal essential coverage or not. But we'll talk more about that and how that plays into the different special enrollment periods and getting them in just a few slides here. The requirement of prior coverage is a really important piece of the special enrollment period puzzle, where you have almost all of the special enrollment periods now. This was a little different early on, but for the most part, almost all special enrollment periods have a requirement that you had coverage before. It remains part of the ACA, and certainly the theme of the ACA and the important piece is we want people to have health insurance and health insurance coverage all year, basically. And while the um mandatory requirement has basically been hand waved away at this point, the requirement of prior coverage remains, and that means if people are um, trying to get a special enrollment period, as I said before, typically it's because they're losing coverage. If somebody has an event out of nowhere, but they didn't have coverage at all in the past, then it might be a disqualifier for them being able to access coverage through the marketplace. So you will see some of that, but we'll get into the specific ones, and you'll see how this all kind of fits together. And it should make sense. And if it doesn't, we can certainly answer your questions. Attestation versus verification. You'll see these on the marketplace application. If you remember from Wednesday, we were in those questions towards the end, where it was asking about, hey, did you have coverage previously? Are you losing coverage? That kind of thing. Um, Most of them in the marketplace application has gotten a little bit more generous, especially because of COVID, to make people's lives easier during the pandemic and in the aftermath, where people can say, yes, I'm losing coverage. And that's the attestation, right? It's just saying, yes, I'm losing coverage. Verification is when the site actually follows up and asks you, hey, we'd like a letter or proof of that end date for that coverage. I will say most things really do default to attestation, although at any point the site on an individual application might follow up and say, hey, we want verification of that income or verification of that loss of coverage. That's pretty common still. And then honestly, I think that eventually we will see a return to asking for more verification. I don't know when that will happen, but it's just something I would expect to see at some point in the future. Advanced availability is interesting. Advanced availability is a fancy term for referring specifically to, hey, if you take action and act on that special enrollment period before you actually lose your coverage, then you can apply uh, typically up to 60 days before losing your coverage and have your new coverage start right away on the first of the month following the end date of the previous coverage. That is I mean, ideally, that's how you're helping consumers. If consumers are getting our information in a timely fashion, they learn their options in a timely fashion, then you can help them before they lose coverage. That's what we like. We want to avoid a gap in coverage whenever possible. So that's hopefully where you're spending most of your time. It does happen, and we'll talk a little bit about what those effective dates look like if somebody, I mean, if you lose coverage and you didn't know your options, and again, I don't expect any consumer to know anything. Don't take anything for granted when you're doing this work. Uh, but if somebody lost their coverage and says, "Hey, I lost my coverage 58 days ago," then advanced availability won't apply, and they'll be within their window for the special enrollment period. We'll talk about that in detail in just a bit here. Regular coverage dates versus accelerated effective dates. Your regular coverage dates. Again, if you're in that advanced availability window, it's typically going to be the first of the month after you lose coverage. Accelerated effective dates are going to be when the it's rare. It applies in some cases, but sometimes a plan will end abruptly in the middle of the month, or a situation. Typically, the one you're going to see. I mean, if you don't see any others, you'll probably see the birth of a child. Right? That will be the change that triggers a special enrollment period, where you can have accelerated effective dates, where it will go right to the first for the day the child was born versus a different day in the month. So that's for accelerated effective dates. You'll see it start kind of mid-month, but beyond the birth of a child scenario, that's pretty rare. And then limitations on plan selection. This is something that isn't spelled out it's not super intuitive, and it's not really loudly spelled out anywhere in the different training materials. I think they're getting better about it. Where if somebody is changing plans within the marketplace, say they have a marketplace plan already, but they have a special enrollment period. Typically, in that case, it's going to be the change in a household. Maybe there's a divorce or birth of a child, something like that. The marketplace is going to make them stay within the same meta level. So we're talking the bronze, silver, gold, platinum. That I'm sure, depending on where you're at in your federal training, you have heard plenty about. But the trick is, for most people, for most populations, the plan is going to, or the site is going to make them stay within that meta level for picking their new plan. The important thing to think about there, that requires some advanced planning. And as an assister, you're in a really good position to do that for folks, because you will be helping somebody say during open enrollment, and they'll say, you know what, hey, my wife is pregnant, and this coverage works for now, or we have the coverage we need now, but they will have a special enrollment period that you can predict later on, and you'll want to make sure that they're in the meta level they need to be in for the plan they ultimately want. Um, that's probably the most common representation of that I can think of, but it can be other cases. Really kind of goes back to those fundamentals of enrollment assistance that I talked through on Wednesday, where you want all the information you can get from your consumers early on. You want to lay all the groundwork and collect all that information early in the appointment before you're really getting anywhere near the point of plan selection, just so if there's going to be a curveball, you're ready for it. You don't want the consumer to walk away from your appointment and then be surprised later on. It does happen. I mean, health insurance is complicated, and especially when somebody starts using their care, the interplay between coverage and care is complicated. But to whatever extent we can, we are in a privileged position to help people not be surprised and able to deal with things that come up. So I said that I wanted to leave you with at least a few things that, if you remember nothing else, I want you to remember this. This is the one, right? Like this resource is the thing I want you to remember. Some of you may be familiar with Health Reform Beyond the Basics. This is a program or project of the Center for Budget and Policy Priorities. They have incredible content. I think Health Reform Beyond the Basics is being sunsetted not this year, but next year. But they have a library of content. Much like what we do for the conference here, they explore different issues in depth and have just a ton of presentations and PowerPoints and PDFs that are really actionable and useful for enrollment assisters. Not just like academic. This is like, okay, how do I do this work? What do I need to know? And for the thing I want you to know today is the special enrollment chart. And I do have that link there. And I will during the Q&A. I think I have it queued up in my notes here. I'll throw that into the chat so people can have that. But this is honestly, you should bookmark this. Absolutely bookmark it. Special enrollment chart, the screenshots, the images you'll see on several of my slides coming up to talk about the different special enrollment periods are directly from this chart. And it's a really good breakdown of the different circumstances that qualify or that trigger special enrollment periods. So you'll see on screen here that table, and I just want to go across the top the different columns of that table so people have a good understanding of what we're talking about here. And that's qualifying event. Okay, that's basically what is the special enrollment period, what is the trigger. We talked about having a requirement to prior coverage. You'll see most of those are going to be yes. And then you'll see things in here like attesting the loss of Medicaid or CHIP within the applicable time period. So again, that attestation versus verification, they at the very least need to say, hey, I've lost coverage. Uh, and then it'll go over timing, when you can apply. We talked about advanced availability, so can apply 60 days before the last day of coverage. Uh, that's that, and then also you'll also see 60 to 90 days. So if you're losing your Medicaid coverage, you'll have up to 90 days after that. That's new as of last year, which is great. You'll have the coverage effective dates. That again is typically going to be the first of the next month after you lose coverage. So ideally acting beforehand. Otherwise, it depends on when you apply. And I'm sure you've seen this in your training, but I will just reiterate it now. Where if you're losing coverage, the say you have your plan and it's ending March 13th, and let's sorry, not ending. So your plan ends March 31st, and you're applying on April 13th. So you've missed the window. The consumers missed the window to have coverage start on April 1st. That's okay. They still have time. They have up to 60 days or 90 days for Medicaid. If they apply and enroll on April 13th, their coverage will start May 1st. Now, if that same person acts after the 15th, that's kind of the trigger that you'll remember from your federal training. They act after the 15th, then it's going to start the first of the following month. So not the next month, but the month after. So that same person lost coverage March 31st. They're applying on April 17th. Their coverage is actually going to start June 1st. And I think that's where it gets kind of tricky for people to remember. So, any questions on that? Put the link in the notes in the chat, please. I think I can do that now. Here, let me see if I can grab that. Let's see. Is there a chat or just the live Q&A? I'm just going to respond to. I'm going to throw it in the presenter chat and ask Elena and Elizabeth to share that for us. That way, I don't need to slow down. All right, good question. All right. And then let's go ahead and throw up that first poll question. So if somebody lost coverage on March 31st and they enroll in a new marketplace coverage on April 17th, when will their coverage start? That should sound very familiar. I think those are my default dates that I have memorized in my head for doing that example. So we'll give people just a minute to respond to that. Okay, and yep, looks like Elizabeth shared that. That's great. So if people respond to it looks like Kate's question there, and they'll see that link to the health form beyond the basic chart. So remember, you forget everything else I say today. Ideally, you remember a couple things, but bookmark that chart because then you won't have to memorize this. And honestly, when you're doing this work, nobody expects you to have all of this memorized. It is very much an active learning environment when you're working with consumers. But knowing where those resources are and how to find them, that's going to be something that people can't do on their own that you will become very, very good at when you do this work. All right, what do we got for our poll question? All right, we got a combination of It will backdate to April 1st, which is interesting because that is kind of at odds with what I said. I can imagine a couple scenarios where where it might work, but all things being equal, say there's no complexity to this particular question. If somebody has lost coverage and they apply on April 17th, the coverage is not, remember, is not going to start May 1st. It's going to start June 1st. All right, so let's get into these bread and butter steps. And if that's still confusing, we can talk more about that. Although, again, I really want people to, as much as possible, live in the um, in the scenario of advanced availability, right? You want to be doing, especially if you're a navigator, you're doing outreach, you're identifying consumers, you're helping consumers reach out to each other through word of mouth, or maybe you're working for a clinic and you're identifying consumers. You want people acting as early as possible, ideally whenever possible before they lose coverage. All right. So, going into some more detail on some of the things I've already covered is the loss of minimum essential coverage. So, as I said, it bears repeating, this is the most common special enrollment period, and it really does underpin so many of the other ones. Coverage must be lost, and it has to be minimum essential coverage to qualify. So, things you normally think of as insurance is the good way for consumers to think about that. I've lost my coverage for my job. I've lost Medicaid or Managed Care Plus. Maybe I had a qualifying student health insurance plan or Cobra, and we'll talk more about those. And we'll talk about things that don't meet that standard as well. That will really highlight the difference. Excuse me. Still sick, but that's okay. Remember, having existing minimum social coverage is really important for triggering most other steps, and then they'll want to sign up for the plan through healthcare.gov before that coverage ends to avoid a gap in coverage. Okay, so other common special enrollment periods that you'll see, moving. People will say, "Hey, I have health insurance. I'm just moving." The trigger for moving is that they have to change county. The site is going to ask you for the zip code and then the new address, and typically you need a special enrollment period because you're changing county. Because the plans in healthcare.gov that you'll see offered to consumers are the providers are tied to the counties, right? Like that's how the system framework is set up. So if somebody changes counties, they want that special enrollment period because they very well may only have access to coverage with new providers. It could be even a neighboring county might not have the same plans offered. It might not cover the same providers. So you really want to pay close attention to that. The change in household size refers to a broad spectrum of changes, although some are more common than others. Typically, you'll see a birth, which you'll want to work with that family pretty quickly after that. I think a lot of new parents and especially provider systems are really good at informing people about, hey, you need to add your child to your health insurance. And again, that is one that will backdate, which is pretty uncommon amongst special enrollment periods. Adoption going through. Marriage and divorce are pretty common. We'll see those. Divorce gets a little tricky because you'll see consumers and they'll be anywhere in the process of divorce, right? It may like if and the site is going to ask if people are still married, and with a few exceptions that we're going to talk about very specifically, if people are married, the site wants them to be married and filing taxes together. Um, Death is also obviously an unfortunate one that you'll see from time to time where you're typically removing somebody from the coverage and you might need to change the plan to something that makes sense for the person or people that's still in the household that are on the case. And these will correspond with changes in the tax household. So just going back to that core language of enrollment assistance, when you're thinking household, you're thinking who's in that tax household, who's filing taxes together. The change in immigration status, you'll see those are always exciting and fun and somewhat complicated. And then release from incarceration or jail as well is going to trigger special enrollment period. And that's one where people wouldn't need to have prior coverage, but they do qualify for a new special enrollment period. All right. I'm just, oh man, my one monitor is very small and I can't make it bigger, but I do want to see this question. It seems like Navigator is using healthcare.gov to facilitate enrollment. Do you have Navigator login you're using or the client's login? You know why agents have to use the EDE partner like Health Sherpa? Navigator should not. So that's an interesting question. It doesn't have too much to do with special enrollment periods, but I'm happy to field it. So direct enrollment assistance questions, like direct enrollment assistance platform like Health Sherpa. I mean, navigators don't do anything special in healthcare.gov. We are working with the consumers. We're sitting down with the consumers, and it's their login information that we're using. So we're sitting there, and we're getting to that point that I showed on Wednesday, where we're adding, "Hey, is somebody helping you complete this application?" And the navigators are using that. I don't know. Wasn't aware the way that you worded this. It sounds like agents have to use it. I didn't. I'm not familiar with the different agency requirements. My understanding was the agents could do it the same way navigators do, where they're going in with the consumer and adding their agent information on that enrollment assistance question of the application. That's certainly it's a little afield from special enrollment periods, but we can talk about that more. I had a patient who had a divorce in the 60-day period. They were denied marketplace insurance step because they did not have a loss of insurance in the 60-day period. That's interesting because the change in the tax household, I actually so that the change in tax household should have triggered a step, and you might have needed to talk to. Sometimes we'll talk about supervisors and tier two specialists. Sometimes the site won't do what you want and you want to call. I will say the divorce question is tricky because I've also seen divorce requirements where the divorce will go through, but one of the stipulations is that that person has to stay on their health insurance coverage. So you'll see that. Um, yeah, Cynthia, that's really interesting, and I don't know what your background is or where you're from in the state, but we can. I would love to dig into that more, and if that happens again, I would absolutely like to investigate because one, if there's something I can do to help that person, I absolutely want to. Two, if there's something that is happening in people's experience out in the wild, as it were, that's different than what they're being trained on, I absolutely want to make sure we get the right information to folks. So I divorces again. I just gotta say they're interesting because I've seen some really interesting agreements and stipulations around the coverage requirement in those. And we can, and I would love to go into more detail on a couple specific ones in the future. All right, patient has an upcoming event that qualifies for social period other than the loss of coverage. Do they have to wait until the move, divorce, etc., or can the application process be started ahead of time? Do they have to wait until the event happens? That's a really good question, and it's a little. I would love the answer to be easy. It's a really good question because the answer isn't easy. Um, Divorce, again, I would like to almost set that one aside because people will start the application process and be looking for coverage wherever they're at in the divorce. And I've had consumers come to me and say, "Hey, I'm in the middle of the divorce procedure, but I need health insurance." And whatever they're expecting the paperwork to go through and be finalized, like that's the important part for figuring out when all of the things apply. And the date is all it moves. It is a moving target, and it gets really tricky and frustrating. Not for the enrollment system, more for the consumer than anything else. Like all I have is sympathy for people going through that challenging time. But for things like the move, the site really does want you to be in your new location. But the trick is, do you have your new address, right? Sometimes people will come to you and say, "Hey, I'm moving. I don't exactly know where, but my lease ends at the end of this month. Can I get coverage?" The thing that's going to hold you up there is not having the new address, but they can go ahead and complete the application before the actual move date. And the application special enrollment period will actually ask when they will be at their new address. So you'll see that. So yeah, that's a really good question. And then whether or not it can be processed, I mean, you can submit the application and it will be processed, but the coverage won't start until I mean, ideally you get everything, all the pieces, ducks in a row. You'll want them. Okay, I'm moving. I mean, that's the trick with moving, right? People move in the middle of the month, and the coverage won't start till the first of next month. So that does get a little tricky, but you should be able to have them stay on their first. Usually, what you see is people stay on their coverage through the end of the month they're on, and then they'll have their coverage start the first of next month. It gets a little tricky, and depending on the distance and the nature of the move, there could be some complexity there that we won't cover as much right now. Good questions, folks. Though I really appreciate it. All right. So uncommon special enrollment periods. These are really good to know. These are like the tricks of the trade, the tools in your toolbox, and they're not necessarily intuitive. I think loss of coverage and kind of underpinning all the other things, it makes a ton of sense. These are going to be like, okay, how, can I help this person who is in a different kind of scenario? So we have the low income special enrollment period. Uh, Bad name. bad name for special enrollment period. It is kind of self-explanatory, but also it doesn't like. I mean, low income is such a broad term. This went into effect in March 2022, and people can apply at any time without a qualifying life event or requirement for no essential coverage. Um, this is really interesting, and it's going to interplay with another special enrollment period we're going to talk about in just a minute here, where it's okay, their income is below 150% and they're eligible for a tax credit. So that means they're going to be below 150%, but above 100%, or they're going to be below 150% and eligible for a tax credit because they don't have the 5-year residency requirement for Badger Care Plus. So they can get tax credit. But typically, this is you're going to see and be able to help people with this when they're between 100 and 150. So they'll be based on they'll be eligible for tax credits based on normal eligibility. And this is really cool because it allows people who are currently uninsured to enroll. So this is one that you should be thinking about when somebody reaches out to you, a very brand new consumer says, "Hey, I don't have health insurance. I haven't had health insurance in 3 months. Is there something I can do?" All right, let's look at your income. Let's see where you fall. Let's see when your income changed. And this is available through the 2025 plan year. I hope it gets extended. And oh man, as I'm speaking now, I wonder if it has. 'Cause I honestly don't know off the top of my head. But this is a good one for right now. Absolutely available any month. First of those following plan selection, and then is there a requirement to of staying in the same meta level? Yes, but again, in theory, they don't have a meta level to speak of to begin with, because most often you'll see people coming to you uninsured for this. Uh, Marketplace application or marketplace call center. So you remember those table headings from the very beginning. How is this accessed? The application will do this one. I will call out some specific ones where you want to engage the call center, because they get a little tricky. Sometimes you need that human being. Sometimes the human being will mess you up a little bit and make things a little bit harder. And ideally, you can identify those situations early. But sometimes you do need to call the call center to actually trigger the special enrollment period. And then newly eligible for tax credits moving out of the Medicaid coverage gap. This is the kind of flip side of that coin. That is really interesting. So we have you're in a particular income limit, and that alone triggers a special enrollment period. So usually it's the change in income that does it. This is kind of the flip side of that, where you'll have somebody who is newly eligible or ineligible for advanced premium tax credit. So they have a change in their income, or if it's not their income, it's their household size, so their FPL, right? That will make them newly eligible or ineligible for a tax credit. So maybe they're going to be filing taxes on their own when previously they had a large family, so their FPL shoots up. That would make them ineligible. More often, you're going to experience change in income that makes somebody newly eligible for tax credits, and oftentimes that will be coming out of the Medicaid coverage gap. So if say there, it won't. You'll see it most often with the loss of Badger Care, right? So like you won't usually see this on its own, and you'll be thinking, oh, this is just a normal case. However, you will see with the moving out of the Medicaid coverage gap, somebody doesn't necessarily need to have been on Badger Care. They just need to have been theoretically eligible in terms of their income. So if they were below 100% of the federal poverty level and they have an increase that would push them over 100%, that is, make them eligible for tax credits, they can get coverage through the marketplace with the special enrollment period. So that is really, really cool. Again, you're hopefully most of the people you work with, if you're under 100%, I would love to see all of those people covered under Badger Care or whatever Medicaid program they're going to qualify for. But in theory, if you encounter somebody who could have been on by their income and didn't have it, they can actually just go right to the marketplace. Now, this gets really interesting when you have consumers you're working with whose income fluctuates a lot, right? Maybe they are young and healthy and don't really know much about health insurance, don't feel like they need it, haven't had to, but their income fluctuates a lot from month to month. This could be somebody's in or opportunity to get health insurance when they didn't have it before, and that is very, very cool. I will say the moving out of the Medicaid coverage gap, where it says CMS caseworker, that's where you're going to want to call and explain the situation to somebody. The application, so the online application can make this work. Typically, you're going to see it. align with somebody who already had coverage, though. So it's almost a moot point. But if you need to access the special enrollment period and the application isn't giving you what you need, go ahead, pick up the phone and call the call center. We do have a new one here for healthcare.gov, eligibility for DACA status. This is coming up. It's going to be new in just a couple of months here, although you've probably seen information on it from Covering Wisconsin. I know we're doing our immigration webinar that we talked about where we'll cover this. But this is very exciting because I have worked with a number of DACA, so Deferred Action for Childhood Arrivals, DACA consumers over the years that have previously been unable to get healthcare.gov coverage, and it's so frustrating. As an enrollment sister, there are a few people that we can do very like that we can't do anything for, and it's I don't yeah, the level of frustration being able to look at somebody and say you're doing everything right, and you really should be able to get coverage, and you can't. It has kind of broken my heart more than once in doing this work, I'll say. But now, starting November 1st, people with DACA status can now get healthcare.gov coverage, which is fantastic. And then they'll be able to apply in November, and if they need to, they can get a special enrollment period for coverage starting December 1st. Otherwise, that is also when open enrollment starts. So typically they'll have coverage starting January 1st, 2025. Some people I'll be really interested in, if we do our work right and get the information out to folks, they'll learn about this. And if they need coverage for December, we'll go ahead and get them covered. Otherwise, these are just newly eligible for open enrollment, and that is fantastic. All right. So talking about another uncommon special enrollment period and a heavy one that I hope you don't encounter, but if you do encounter, this is one that you want to be ready for. And if somebody presents to you and they need health insurance, I want you to be well informed on how to help them. So, if you have a special enrollment period for a survivor of domestic abuse or violence or spousal abandonment, they can enroll in a health plan separate from their abuser or abandoner. And same thing if they have the children with them, their dependents, they may be eligible too. The most important thing, and the thing actually that I'm looking at the slide, and I wish I had bolded, is this next one, right? Because almost always when you're working with a couple, the marketplace wants you to select married and filing jointly, right? That's what's going to trigger a special or the tax credits for a married couple. This is the one, I think maybe two. This is one of the very rare circumstances in which you can indicate, and the federal guidance says to indicate something other than what is actually the case, where you'll have the um, consumer who has been the victim of domestic abuse. They'll come to you and they can answer unmarried, even if maybe they're in hiding from that person, maybe they've cut off all communication and there's legal documents in place. If they're still married on paper, this is one of the rare instances where they can answer unmarried on the application. There is still a requirement of prior coverage, which, I mean, I don't love, but it is what it is. They may or may not ask for verification of that, or it could just be attestation. But there is no plan selection limitation. So that if they had, say, uh, been previously on the marketplace and had a silver level plan, they can change if they need to, which is good because these situations are hard, right? They often accompany moves and different situations with the children or jobs and things like that. So these are always tricky, but you want to know that this person does have the option and they should feel safe and empowered to select unmarried on that application to access this special enrollment period. So you can apply at any time. These are delicate and complex situations, and the consumer is not restricted on when they seek the special enrollment period after being impacted. And what I mean by that, I've helped a number of people who have been in this situation, and when they apply does not matter so much. There are very few questions asked, and I think that's right. Right? We don't. I To me, if you are unfortunate and have been the victim of domestic abuse or violence, spousal abandonment, then when you are able to, put yourself together and figure out your health insurance situation, there should not be a time requirement on that. The rate at which you're able to take care of the things you need to take care of in your life should not be okay. Now you need health insurance 60 days. No, that is an ongoing circumstance that you address when you can. And I have been able to, I don't think I've ever gotten somebody stuck based on timing for this particular special enrollment period. Okay, unexpected situations. I mean, hopefully some of these that we talked about, yeah, just change your pace, take a deep breath after the last one, um, are going to be unexpected. So these get a little tricky, but they can result in special enrollment periods. We'll have an unexpected hospitalization, temporary cognitive disability, or we're otherwise incapacitated. We saw this a lot during the height of COVID, right, where people were in the hospital, and usually the language around these is that it stops somebody from applying, right? It stops somebody from completing their application. With the next one, it's experience a natural disaster. Typically, that has to be one that is covered under FEMA. We will see in Wisconsin typically a really bad blizzard that's knocking out power and things like that can qualify. I feel like there are some in the summer as well. Sometimes you might have like heat or wildfires, things like that, where the what you'll typically do and when you're helping the consumer, you'll indicate, hey, I was displaced temporarily. I didn't have access to my computer, any resources. There was no way I could have completed my health insurance application. And typically where you'll see these is like, okay, that's why you missed the deadline. And you'll want to um, the point I'm getting is that last bullet is the event will have prevented you from enrolling during open enrollment or another qualifying SEP. And for this one, the website's not going to be sophisticated enough to help you here. You're going to need to call the call center, and if the person you first talk to isn't able to trigger the special enrollment period, you'll want to talk to a supervisor, or the language we'll use when we call the marketplace is a tier two specialist. Sometimes, I mean, the more experience you get, the more calls you have at the call center, the more ready you are instinctively to just say, I need a tier two specialist. You don't want to waste any time. But typically, when you explain the situation to that person, they will be able to actually trigger the special enrollment period. So you'll say thank you, and then you'll hop back in the application, and it should just work. Um, and typically these are attestations. I think I've had to do a verification for them before, and honestly, what worked was either a statement from me, from a provider, or from the consumer themselves, just saying this is what happened, and that often will satisfy a verification requirement for something like this. This question for the victim of domestic violence is this. If the spouse later files taxes jointly, can the abused spouse be required to pay back tax credits received because of the higher income? Could there be other implications? Um, I wish I had one of my tax people on with me right now. The I will say the protections in place, that person should not have to pay back any tax credits. And the income situation could get really tricky. And I think there are other tax implications that are even beyond my wheelhouse as a veteran enrollment assister. But I have not personally seen anyone have to pay back tax credits because of that. But yeah, the tax situation itself could spiral outside of scope of kind of the health insurance situation that we help with. But in terms of tax credits, no, that person should not have to pay back any tax credits. Could there be other implications to your question? I fear that there could be, and that's when you really want to do everything you can as an enrollment sister to make sure that person has a robust support system to address the different things that could come up. All right, good question. The American Indian or Alaska Native. This is a very cool special enrollment period, a very cool status, I should say, that allows for a special enrollment period because it is very generous and flexible, and it transcends most of the other rules that we talked about or that you'll get very used to doing this work. So if somebody is an American Indian or Alaska Native, they can change coverage anytime during the year. They can apply for coverage anytime during the year without having prior coverage. It will ask for verification. In my experience, I don't know if that's changed to attestation or verification, but typically in the past they've asked for a document issued by a federally recognized tribe indicating their tribal membership. That can vary from a card to a piece of paper, etc. Or a document issued by an Alaska Native village or tribe. Um, so typically a regional or a village document indicating that they're a shareholder in that village. Obviously, we see Alaska Native less. If you're helping people in Alaska, I have questions for you. But we do see a lot of federally recognized tribes. We have plenty in Wisconsin. And really, I think a lot more can be done to educate the people on the different tribal lands in Wisconsin to let them know that they have these options, because it is a really cool opportunity that is not afforded to most other people, and they can enroll anytime, but even beyond between 100 and 300% FPL, they can enroll in a zero cost sharing plan, which means they don't have to pay out of pocket costs. Their deductibles, their copays, co-insurance. The healthcare.gov link there has really great information on this and how it works. But really, it's very cool to see in practice when you're helping a tribal member and can say, okay, you can get this plan. Yep, doesn't matter what time it is, and also you don't have any of the cost sharing. Like that, that is a very rare and cool thing to be able to give to somebody or help them with. Okay, misrepresentation. Oh boy. So this is an interesting category, and I think the insights shared during the fraud and unauthorized enrollment session will be incredibly enlightening on how this has evolved since I mean, since I started doing special enrollment period presentations. Certainly since I first saw my first misrepresentation case, absolutely. uh, but you'll see misrepresentation as a kind of a broad category, and you'll see these most commonly right after open enrollment period, when people go to use their coverage and realize that it's not what they thought it was. And when I say go to use their coverage, it might not be marketplace coverage. It's whatever someone has signed them up for or helped them sign up for, and they were typically pitched, hey, this is what you need, and people, they don't know any better, and they shouldn't have to. Um, so there is a lot of fraud and misinformation out there, and we saw a huge spike of it in 2024. So you'll get to learn more about that. But yeah, misrepresentation, very broadly defined, and it can include enrolling somebody in a marketplace plan that doesn't meet their needs, including a network that doesn't have providers in their area. That's a lot of what we're seeing for the unauthorized enrollments this year. Is people will sign somebody up for a $0 plan, and that sounds great. I mean, you could easily pitch somebody on something that doesn't cost them anything, but then they'll find out their providers aren't covered, and that's when it gets back to that very first poll question that I had on Wednesday, where it was, "Hey, what do you think the most important thing is?" Oftentimes, when somebody really needs to use their health insurance, it's what provider can I go to? And then, or it might be something off the marketplace. And I mentioned, and I do have a slide talking about what these are a little bit. A plan or product that doesn't meet MEC. And if you're hearing the word product, that's already a red flag. The effective date may vary. These can be backdated sometimes. It really kind of depends on the nature of the misrepresentation or the fraud or whatever action was taken with that consumer. Oftentimes, if possible, best case scenario is it's not super complex. The person catches it early before they start racking up medical bills, and you can help them apply and just change the plan for the future. That's what you're going to hope for. Otherwise, these do get kind of messy. Errors and mistakes. So there can be either a technical error when somebody goes to apply through the marketplace website that prevents a consumer from enrolling, or the health plan from getting their information. So maybe they did their application, everything right, but the health plan didn't get their information, so their coverage didn't start when it was supposed to. That can be difficult to prove, right? If there's not a paper trail, it's very hard to prove a negative, right? Where somebody didn't get something, it can be difficult to verify. I will say the I see less and less of that, at least in a timely fashion. But I'll say that's thankful. Versus mistakes, human error. If a navigator or other assistant makes a mistake on an application, it can qualify an individual for special enrollment period. Uh, know that as a navigator or an assister, if you make a mistake, an honest mistake, so you're acting in good faith, trying to help somebody, and you do something wrong, and it messes with their coverage, they may be able to get a special enrollment period. And also, like I've asked navigators this repeatedly over the years. Hey, if you've used a special enrollment period, if you said, hey, I made a mistake, I have never seen this jeopardize or threaten somebody's license or ability to continue doing this work. So please don't be afraid to say, oh, mea culpa, I made a mistake, and this consumer needs help. That can be sometimes exactly what the consumer needs, and you shouldn't be afraid of that. All right. Successfully accessing encompasses kind of an umbrella here for these. These uncommon ones are almost always triggered using the Marketplace call center and that describing or testing to the corresponding situation. Sometimes follow-up verification is needed, but a lot of times it's either not or that verification can be as simple as just a statement from the consumer. Excuse me. So steps for misrepresentation, errors, and mistakes may require an appeal. Ideally, not. And the site and the call center seem to be getting better about these. Almost by necessity because of the unfortunate circumstances that happened this last year. But we this is not the appeals training. But sometimes you will need to do an appeal with a consumer, and yeah, I would love to talk more about that in the future to educate people on how to do an appeal when one might be necessary. And that is something that you don't do that often, but you will get better at it. Right now, for those kind of misrepresentation errors and mistakes, you want to access kind of the resources available through OCI, fraud complaints, the marketplace, and we'll go. You'll hear a lot more about that next week. And then pro tip, if you know your stuff, right? You've done your homework and you know this person should be getting a special enrollment period and the marketplace representative isn't giving you the right answer, call back and talk to somebody else. Like, I mean, ideally politely. We've all been at our wits end on the call center with the marketplace before, and it's maybe less polite than we would hope. But sometimes you just it's who you're talking to, and you'll get somebody on the phone and they're acting as a gatekeeper when they absolutely shouldn't be, or they're not understanding the situation you described, and it just might be that you need a different human. And maybe that was the case with that person with divorce that we talked about. But it's hard to say without knowing all the details. I will say we got 9 minutes left, and we're right on track with time. But I do want to make sure we have time for questions. So interesting thing that came up. It's kind of a little bit more abstract, but in 2023, we had 2 hospitals and 19 clinics, that should be a word there, clinics closed in Western Wisconsin. Uh, there was no special enrollment period specifically for health systems closing, which is, for example, if the provider network changes. So that was really interesting, right? So say I enrolled in a plan and and could see my doctor, but then the hospital closed and my doctor's no longer there, but the plan still exists. There was actually no special enrollment period for something, despite the fact that it was beyond the consumer's control. Um, so there were probably other options for those. If you think back to earlier in the presentation when we looked at kind of those income fluctuations, special enrollment periods, those might have given somebody the option to switch to another plan. So sometimes it just requires being creative. And really looking at somebody's, like, you want to know their income situation, you want to know their household situation, their fluctuations. Maybe somebody moved in that situation, something that you might not have thought of. I needed a special enrollment period for this, but they had one. It may be something that if something like this happens, that they're able to access that. And then I know that OCI, DHS, and the state were considering these, and that there were public announcements around that. Although I should follow up with the sisters in that area to see how all that panned out. I wonder where some of those people ended up. We're just going to summarize some special enrollment periods here. So think about ones that don't require prior coverage, just so you have a handy short list. The low income special enrollment period, so people below 150% FPL, birth, adoption, or placement for adoption or foster care, newly eligible immigration status, American Indian, Alaska Native we talked about, be, being determined ineligible for Medicaid, error, misrepresentation, inaction, misconduct. I will say that one's kind of interesting for not requiring prior coverage because that can be because of oftentimes they'll have had coverage that wasn't minimum essential coverage. They might have something, but it's not coverage. And then exceptional circumstances, and then FEMA, you'll see that a lot, especially I'm thinking of winter storms during open enrollment that prevented people from completing their application. So that we'll typically see. Of course, they didn't need to have prior coverage if it was OE. Other considerations, and I do need to get to this last point because I know we got that last there it is. Poll question coming up quick. Consumers who are going to lose coverage mid-month should act before the first day of that month to avoid a gap in coverage. So, for example, the consumers losing coverage February 11th, they should select their plan February 1st. So the coverage would begin February 1st, so they might have an overlap. If they were to get care during that period, they might have two coverages. But at least then they won't have a gap and it can start on the 12th. That period of overlap of dual enrollment does not impact their tax credits or cost share reductions. The worst things you'll see from that is the two plans kind of fighting over who the payer should be, and that's its own kind of complex set of questions. But if they enroll in a new plan later in February, the coverage will start March 1st, and then they'll have that gap. So COBRA, the Consolidated Omnibus Budget Reconciliation Act, which I don't think is super useful language, and that's why I don't have it spelled out here because I don't think people need to know it. COBRA being when an employer coverage, employment or employer coverage is ending, but the employee can continue to take the health insurance either by paying full price or the employer takes pays a portion of it or all of it. So if a consumer elects to take Cobra, regardless of its affordability, they won't be eligible for a SEP later in the year. That's super important. So example from earlier, someone's losing coverage the end of March, but they can take Cobra. And they do. They come to you in September and say, "Man, these payments are killing me. I really want to see if I can get in the marketplace." Because they elected Cobra, they won't be eligible for a special enrollment period, which is really unfortunate. However, um, if a consumer is informed early on, say they took Cobra, but they still have the original window from when they lost their coverage, they can still get into the marketplace. They can say, "Oh, no, I don't want Cobra. I want marketplace coverage." And then when an employer stops paying their portion of Cobra, this is something we see a lot. So people will often take Cobra because they don't want to change their providers. Maybe they met their out-of-pocket costs on deductibles, things like that. And the employer is going to pay it. Then great, and it's often the right option. It becomes a really interesting conversation. When the employer stops paying their portion of Cobra and the price increases, a consumer will be eligible through for a special enrollment period through the marketplace. It's the same as losing coverage. It's losing the affordability, right? So when an employer stops paying their portion, say the premium shoots up and suddenly a consumer's expected to pay $700 to maintain their coverage, they can get a special enrollment period in that case. And then if a consumer elects Cobra and misses the original SEP window, they do have to wait until open enrollment to get marketplace coverage with APTCs. All right, let's load up that last poll question. See if I can see it. All right. True or false, if a consumer elects to take Cobra after losing job-based insurance, they will be eligible for a SEP when the employer stops paying their portion of the premium. Hopefully very fresh because I did just go over this. Most people are saying true. All right, we've just got a couple minutes left, so I will say yes, that is true. Um, And then just gonna go over junk plans and other coverage before we get to the final Q&A. So people with the misrepresentation and things like that will be sold and marketed different things that do not count as minimum essential coverage. So you see short-term plans that last 364 days sometimes, fixed dollar indemnity plans, things we often refer to as junk plans, and they'll often be bundled with accident or disability policies, things like health insurance sharing ministries. Losing these typically doesn't count as losing coverage because again, it's not minimum essential coverage, but there will often be a fraud or misrepresentation component that can make someone eligible through a special enrollment period based on those circumstances. And then verification considerations. Some just things require proof, and there you may encounter data meshing or technical issues. And sometimes a SEP won't trigger until those are resolved, but it will kind of it'll prevent the enrollment, but the SEP will trigger after the verification is complete and allow you to get those original dates. But I do want to, let's see, we have 2 minutes for a minute, actually a minute and 15 for Q&A. So I do want people to feel like they can go ahead and ask any questions they have. Hopefully this was informative and gives you what you need to know to help you with special enrollment periods. And if nothing else, you've got that bookmark for the special enrollment chart. I'm gonna look at the Q&A and see, I don't see anything there. I thought the questions that have come in so far have been fantastic though. Thank you all for your participation and for sticking it out with pre-licensing all week. You get to do more fun conference stuff, but now you all have the foundation of everything you need to do this work and help people, and we can get into some really interesting topics next week. So not seeing any questions. Elizabeth, do you have any final thoughts for folks?
I was just going to thank everyone for joining us the last 3 days, 8 hours total so far. And we are looking forward to next week for the main conference. There's some interesting stuff that's going to be happening. So, yeah, I'm excited.
Right. Thanks, everybody.
Thank you.